NMCCBT questions and answers. Question number 476. The wife of a recently deceased male is contacting individuals to inform them of her husband's death. She decides, however, to drive to her parents' home to tell them in person instead of using the telephone. Of what benefit did this communication approach serve? Option A, she needed to get out of the house. Option B, for the family to gain support from each other. Option C, no benefit. Option D, she was having a pathological grief response. The correct answer is option B, for the family to gain support from each other. Question number 477. The 4-year-old son of a deceased male is asking questions about his father. Which of the following activities would be beneficial for this young child to participate in? Option A, nothing because he's too young to understand death. Option B, tell him his father has gone away, never to return. Option C, tell him his father is sleeping. Option D, explain that his father has died and give him the option of attending the funeral. The correct answer is option D, explain that his father has died and give him the option of attending the funeral. Question number 478. When breaking bad news over phone, which of the following statement is appropriate? Option A, I am sorry to tell you that your mother died. Option B, I am sorry to tell you that your mother has gone to heaven. Option C, I am sorry to tell you that your mother is no more. Option D, I am sorry to tell you that your mother passed away. The correct answer is option A, I am sorry to tell you that your mother died. Question number 476. After breaking bad news of expected death to a relative over phone, she says thanks for letting us know and becomes silent. Which of the following statements made by nurse would be more empathetic? Option A, say I will ask the doctor to call you. Option B, you seem stunned. You want me to help you think what you want to do next. Option C, call me back if you have got any questions. Option D, say can I help you with funeral arrangements. The correct answer is option C, call me back if you have got any questions. Question number 480. A 52-year-old man is admitted to a hospital after sustaining a severe head injury in an automobile accident. When the patient dies, the nurse observes the patient's wife comforting other family members. Which of the following interpretations of this behavior is most justifiable? Option A, she has already moved through the stages of the grieving process. Option B, she is repressing anger related to her husband's death. Option C, she is experiencing shock and disbelief related to her husband's death. Option D, she is demonstrating resolution of her husband's death. The correct answer is option C, she is experiencing shock and disbelief related to her husband's death. Question number 481. In which of the following situations might nitrous oxide, Entonox, be considered? Option A, wound dressing change for short-term pain relief or the removal of a chest drain for reduction of anxiety. Option B, turning a patient who has bowel obstruction because there is an expectation that they may have pain from pathological fractures. Option C, for pain relief during the insertion of a chest drain for the treatment of a pneumothorax. Option D, for pain relief during a wound dressing for a patient who has had radical head and neck cancer that involved the jaw. The correct answer is option A, wound dressing change for short-term pain relief or the removal of a chest drain for reduction of anxiety. Question number 482. Nurse should be able to show awareness of his her role in health promotion and supporting a healthy lifestyle. Whilst providing health education to a group of patients with cancer about management of their non-healing wounds, it is important for one to: Option A, consider individual wound management priorities. Option B, review the patient's treatment plan. Option C, determine the locations of the wounds. Option D, verify the types of cancer. The correct answer is option A. Consider individual wound management priorities. Question number 483. Margaret has been diagnosed with hepatic adenoma. Her results are as follows. Benign tumor as shown on triphasic CT scan and alpha-fetoproteins within normal range. She is asymptomatic and does not appear jaundice, but she appears to be very anxious. As a nurse, what will you initially do? Option A. Sit down with Margaret and discuss about her fears. Use therapeutic communication to alleviate anxiety. Option B. Refer her to a psychiatrist for treatment. Option C. Discuss invasive procedure with patient, and show her videos of the operation. Option D. Take her to the surgeon's clinic and discuss about consent for invasive procedure. The correct answer is option A. Sit down with Margaret and discuss about her fears. Use therapeutic communication to alleviate anxiety. Question number 484. A patient who has had Parkinson's disease for 7 years has been experiencing aphasia. Which health professional should you make a referral to with regards to his aphasia? Option A. Occupational therapist. Option B. Community matron. Option C. Psychiatrist. Option D. Speech and language therapist. The correct answer is option D. Speech and language therapist. Question number 485. You are dispensing morphine sulfate in the treatment room, which has been witnessed by another qualified nurse. Your patient refuses the medication when offered. What will you do next? Option A. Go back to the treatment room and write a line across your documentation on the CD book. Sign it as refused. Option B. Dispose the medication using the denaturing kit. Document as refused and disposed on the Mars, and write it on the nurse's notes. Option C. Dispose the medication and document it on the patient's care plan. Option D. Store the medication in the CD pod for an hour, and then ask your patient again if he/she wants to take his medication. The correct answer is option B. Dispose the medication using the denaturing kit, document as refused and disposed on the Mars, and write it on the nurse's notes. Question number 486. A resident is due for discharge from your nursing home. You have been his key worker for the last 5 years, and his family has been appreciative of the care you have provided. One of the relatives has offered you cash in an envelope after saying goodbye. What should you do? Option A. Say thank you, but refuse the offer politely. Option B. Say thank you and accept the offer. Option C. Accept the offer, and share it to your colleagues. Option D. Accept the offer and keep it to yourself. The correct answer is option A. Say thank you, but refuse the offer politely. Question number 487. One of your residents has been transferred from the hospital to your nursing home after having been admitted for a week due to a chest infection. On transfer, you have noted that he had several dressings on his thighs, which he has not had before. What should you do? Option A. If the dressings are intact, document it on the nursing notes and indicate that the dressings need to be changed after 48 hours. Option B. Change the dressings if they look soiled and document this on the wound assessment form. Option C. Remove the dressings whether they are intact or not. Assess the wounds. Document this on the wound assessment form and redress the wounds. Option D. All of the above. The correct answer is option C. Remove the dressings whether they are intact or not. Assess the wounds. Document this on the wound assessment form and redress the wounds. Question 488. A 30-year-old male from Haiti is brought to the emergency department in sickle cell crisis. What is the best position for this client? Option A. Side lying with knees flexed. Option B. Knee chest. Option C. High phallus with knees flexed. Option D. Semi phallus with legs extended on the bed. The correct answer is option D. Semi phallus with legs extended on the bed. Question number 489. A newly admitted client has sickle cell crisis. He is complaining of pain in his feet and hands. The nurse's assessment findings include a pulse oximetry of 92. Assuming that all the following interventions are ordered, which should be done first? Option A. Adjust the room temperature. Option B. Give a bolus of IV fluids. Option C. Start O2. Option D. Administer meperidine, Demerol, 75 mg IV push. The correct answer is option C. Start O2. Question number 490. The nurse is monitoring a client following a lung resection. The hourly output from the chest tube was 300 milliliters. The nurse should give priority to option A. Turning the client to the left side. Option B. Milking the tube to ensure patency. Option C. Slowing the intravenous infusion. Option D. Notifying the physician. The correct answer is option D. Notifying the physician. Question number 491. Nurse is assisting the physician with removal of a central venous catheter. To facilitate removal, the nurse should instruct the client to option A. Perform the Valsalva maneuver as the catheter is advanced. Option B. Turn his head to the left side and hyperextend the neck. Option C. Take slow, deep breaths as the catheter is removed. Option D. Turn his head to the right while maintaining a sniffing position. The correct answer is option A. Perform the Valsalva maneuver as the catheter is advanced. Question number 492. A client with cancer of the pancreas has undergone a Whipple procedure. The nurse is aware that during the Whipple procedure, the doctor will remove the option A. head of the pancreas. Option B. Stomach and duodenum. Option C. Esophagus and jejunum. The correct answer is option A. Head of the pancreas. Question number 493. A client who is admitted with an above-the-knee amputation tells the nurse that his foot hurts and itches. Which response by the nurse indicates understanding of phantom limb pain? Option A. The pain will go away in a few days. Option B. The pain is due to peripheral nervous system interruptions. I will get you some pain medication. Option C. The pain is psychological because your foot is no longer there. Option D. The pain and itching are due to the infection you had before the surgery. The correct answer is option B. The pain is due to peripheral nervous system interruptions. I will get you some pain medication. Question number 494. A client with an abdominal cholecystectomy returns from surgery with a Jackson-Pratt drain. The chief purpose of the Jackson-Pratt drain is to option A. Prevent the need for dressing changes. Option B. Reduce edema at the incision. Option C. Provide for wound drainage. Option D. Keep the common bile duct open. The correct answer is option C. Provide for wound drainage. Question number 495. A client with pancreatic cancer has an infusion of TPN, total parenteral nutrition. The doctor has ordered for sliding scale insulin. The most likely explanation for this order is option A. Total parenteral nutrition leads to negative nitrogen balance and elevated glucose levels. Option B. Total parenteral nutrition cannot be managed with oral hypoglycemics. Option C. Total parenteral nutrition is a high glucose solution that often elevates the blood glucose levels. Option D. Total parenteral nutrition leads to further pancreatic disease. The correct answer is option C. Total parenteral nutrition is a high glucose solution that often elevates the blood glucose levels. Question number 496. A carer has reported that she has seen a resident fall off his bed. What initial assessment should be done? Option A. Check the patient's early warning score along with the Glasgow Coma Scale immediately. Option B. Ask the patient if he is in pain. If so, administer painkillers immediately. Option C. Dial 999 and request for an ambulance to take your patient to the hospital. Option D. Contact the out-of-hours GP and request for a home visit. The correct answer is option A. Check the patient's early warning score along with the Glasgow Coma Scale immediately. Question number 497. On admission of a service user, you have done an informal risk assessment for pressure sores, and you have noted that the patient is currently not at risk. What will be your next step? Option A. Include the repositioning chart on your patient's daily notes, and instruct your carers HCAs to turn your patient every 2 hours. Option B. Alert the general practitioner about your patient's condition. Option C. Reassess your patient on a regular basis and document your observations. Option D. Modify your patient's diet to maintain intact skin integrity. The correct answer is option C. Reassess your patient on a regular basis and document your observations. Question number 498. Mr. Smith has just been certified dead by the general practitioner. However, no arrangements have been made by the family. What should you do first? Option A. Check patient's records for the next of kin details, and contact them to discuss about funeral services. Option B. Ring the cooperative and arrange for the undertaker to pick up Mr. Smith as soon as possible. Option C. Contact the GP and discuss about how to deal with Mr. Smith. Option D. Contact your manager and inquire about dealing with Mr. Smith. The correct answer is option A. Check patient's records for the next of kin details, and contact them to discuss about funeral services. Question number 499. A patient with a nutritional deficit and a MAST score of 2 and above is of high risk. What should be done? Option A. Refer the patient to the dietitian, the nutritional support team and implement local policy. Option B. Observe and document dietary intake for 3 days. Option C. Repeat screening weekly or monthly depending on the patient's food intake during the last 72 hours. Option D. All of the above. The correct answer is option A. Refer the patient to the dietitian, the nutritional support team and implement local policy. Question number 500. Based on the National Institute for Health and Care Excellence, NICE, guidelines, which of the following is incorrect about sharps container? Option A. It must be located in a safe position and height to avoid spillage. Option B. It should be temporarily closed when not in use. Option C. It must not be filled above the fill line. Option D. It must not be filled below the fill line. The correct answer is option C. It must not be filled above the fill line.